Hello everyone, this is Doc coming to you with another video for our Train to Survive video series. And this video is going to be done by me. And this particular video is going to be an interesting subject. This is going to be a video showing you how to suture a wound. I know there are a lot of videos on YouTube that show you how to do that. However, I'm going to do it again just so that you can see. A couple things before I start is that if you get cut, you need to go to the hospital. You need to go see a doctor. I believe it's John Campbell from ArizonaBushman.com. His YouTube name is Desert Survivalist. He recently had an accident while he was out filming, and he was smart enough to drive to the hospital. He ended up with some issues with his hand, and it's an extremely good idea that he didn't try to take care of that himself. He was a perfect example of what you should do if you were injured and have any possible way of getting to a hospital. However, this video series is more geared towards survival if you're in a situation where you can't get out. If there are no other options. I do not in any way, shape, or form condone somebody doing this themselves. If you get cut, go to a hospital. Go see a doctor. Just to put it on the table, this video is for entertainment purposes only. It's not to be, this is not a guide on how to go take care of yourself. We're not playing doctor here. If you have issues, there are a lot of complications that can go wrong. There's infections, which could lead from you getting sick all the way to the loss of the limb. So it's not a joke. Just so everyone is aware of that, this video is not telling you to do this stuff yourself. This video is telling you to go to the hospital. However, if you are in a situation where you have no choice, this is one of the things you can do. Okay, now we've got all that out of the way. What you're going to need is you're going to need a set of hemostats, a pair of tweezers, a pair of scissors, some antibiotics, alcohol prep wipes, iodine, and your suture. Now there are many options you can take. One of the options, which is a very good option, is to carry something like this. These are called Steri-strips. These are very similar to that of a butterfly bandage. When you open the package, they have four long strips in here, and you can take them out and actually put them across the wound like it was a butterfly bandage. Put it on one side, pull it tight, put it on the other side. Make sure that you're taken care of that way. However, if you have to go and suture, this is what you're going to do. I'm not going to put on latex gloves right now. This is just a demonstration. This here is just a piece of latex from our Halloween displays. First off, you're going to do is make sure everything is sterile. Sterilize everything, boil it, put it in boiling water. Everything you're going to touch. Your gloves, everything. You're going to use a good antiseptic wipe. You're going to clean the wound as best you can. Flush it out. And what you're going to do, you're going to take your hemostats. This is assuming everything else was done the way it was supposed to be done. You're fully taken care of as far as sterility goes. You're going to take your suture needle. And let me zoom this in now so you can get a good close look at what I'm going to be doing here. Okay. You're going to take your hemostats and you're going to grab your suture needle like so. Okay. You're going to stay away from the tip of the needle. You never want to come in contact with the tip of that needle. Okay. This entire process needs to stay sterile, and you want to make sure you don't touch the tip of the needle because you can bend it or dull it, and that's counterproductive to what you're trying to do. So what you're going to do is you're going to grab your needle approximately 2/3 of the way down the needle, as you can see by my thumb. Sorry about the video here. I'm trying to get this as straight for you as I can. Okay. What you're going to do, holding the needle facing down, you're going to push the needle in and you're going to rotate your wrist. Sorry, it's hard to do this on a table. It's not an actual thing. You're going to push it through. You're going to let go with your hemostats. You're going to push the needle all the way through and out the other side. You're going to grab your needle, you're going to pull it all the way through. Okay? You pull it so you can leave a little bit of tail on the end of the thing there. You're going to take your needle again, and just like you did the first time, you're going to reload the needle in the hemostats. Same way you did the first time. Just like that. Okay? Now, you're going to come across the wound to the other side, approximately the same distance as before, as you went in, and you're going to press the needle through. You're going to grab it, and you're going to pull the needle all the way through. Okay? Now, one thing you have to keep in mind when you're doing a suture is, sutures are always done in halves. If you start off at one side and give your sutures all the way across, you can end up with uneven corners, and the scar's going to be really bad that way. Okay? So everything is done in halves. Since you have your incision, you're going to go halfway, you're going to close the middle. Once you have the middle closed, you're then going to close the middle of the next set. You're going to do it like that. Once you have the needle through both sides, you're going to lay your hemostats in the middle of the wound. You're going to take your suture and you're going to wrap it around the hemostats twice. Once you've done that, you're going to grab the end of the line and you're going to pull it. However, you're only going to pull it tight enough. See if you can see that. I'll pull it just tight enough that the skin actually touches both sides. You don't want to pull any harder than that. Okay? Once you have that pulled, you will then lay your suture in your hemostats in the middle of the suture again, and this time you're going to go back the other direction. One turn. Grab the end, pull it through. Okay? So just till the two edges of the skin come together. One more time. You're going to lay your hemostats in the middle. I'm going to go around one time, grab it, pull it through to lock that stitch. You also want to keep the stitch and everything off to the side so that it's not directly over the wound. Okay? Now I'm going to show you, once you're done with that, you're going to clip this just enough so that the ends of this thread don't end up in your next suture. Okay? Now what I'm going to do here is, this is going to be slightly different. I'm now going to do the same thing, except I'm going to use a regular needle and thread. And I'm doing this so that you can see how the knot is actually done. I know that the thread we're using on this here is extremely small and thin. It's kind of hard to see. So I'm going to show you how to do it now with a bigger needle and bigger thread. Okay? This is just for to be able to show you. This is illustration purposes only. What you're going to do, this is your knot essentially. Okay? You're not really going to do it like this. I'm just doing this to speed up for the sake of time. Okay? You pull your needle through. And what you're going to have